everyone. Thank you for having us here today. My name is Udit.
And I'm Emma Lewis.
We're both third-year medical students at Tulane. These are disclosures. None of them are ours. So a common complication of knee arthroscopy is deep vein thrombosis, and this can be a life-threatening complication. And common DVT prophylaxis methods include aspirin, anticoagulants, and factor Xa inhibitors. And so far, we haven't been able to really find a standardized guideline of DVT prophylaxis in the arthroscopy. And in this setting, like the prophylaxis regimen that's standardized does not really exist. And so we had a two-part purpose to our study. So primarily wanted to summarize how DVT prophylaxis is performed for patients who do undergo knee arthroscopy. And then secondarily, we wanted to try to come up with a universal suggestion for DVT prophylaxis in the setting of knee arthroscopy specifically.
And our methods, we did a systematic review of PubMed, Embase, and Cochrane Library. The characteristics we included, all of our studies were published within the last 25 years. They were prospective RCTs evaluated in males and females of any group who underwent knee arthroscopy procedures. Studies reported DVT prophylaxis regimens in knee arthroscopy patients and subsequent DVT incidents. And we excluded any studies that were animal studies, cadaveric studies, non-RCTs, and non-knee arthroscopy procedures.
And so ultimately, we ended up including 15 studies in our study. And so the DVT prophylaxis methods across all these studies included compression stockings, aspirin, factor Xa inhibitors, low molecular weight heparin, and neuromuscular electrical stimulation. And so a little fewer than half of these studies actually supported DVT prophylaxis in all patients, regardless of any risk factors. And then about 20% of them supported DVT prophylaxis. These risk factors delineated were familial thrombophilias or Asian race was actually found to be a risk factor in a lot of studies. So this was found to be a population that was considered high risk for a lot of these studies. And then lastly, about a third of these studies didn't support DVT prophylaxis in any capacity.
Our key finding, we found that a large proportion of RCTs utilizing primary data advocate for DVT prophylaxis in about 7 out of 15, or a high risk subset, 3 out of 15. Only 5 out of 15 studies suggested that no DVT prophylaxis was needed after knee arthroscopy, but these studies assumed that the driving force behind the decision-making was post-arthroscopy DVT, a low incidence of it.
So to conclude, patients undergoing knee arthroscopy are definitely at a higher increased risk for DVT incidence, and factor Xa inhibitors and low molecular weight heparin drugs are safe and effective options that we can use to for DVT prophylaxis in these patients. And this is especially important in patients that are already at a high risk for having a DVT. Answer any questions.
Did your study have, or did they show any preferences for which DVT prophylaxis? So Xa and low molecular weight heparin.
In terms of how the other studies viewed them or how we viewed them before we.
How the other studies viewed them, like were there specifics? Did they prefer one over the other? Said that both are functional, but they prefer this, or just?
Yeah, so we found that a majority of studies just happened to look at low molecular weight heparin. So I guess we can assume that that's the preferred one just in terms of volume, but we didn't find that a lot of studies looked at multiple different methods to do that. A lot of the times compression stockings were used kind of as like a control versus a drug. But beyond that, on a pharmacological scale, we didn't see any difference.